I'm a trainer. What side did you land on?
The outside.
Well, it gotta be
The ATF. CF.
or PTF or the peroneals. First,
It hurts so much.
let's test the peroneals.
To test the peroneals, make sure the knee is flexed at 90 degrees. Resist the lateral aspect of the foot while the patient resists against your hand. This test proves positive if the patient feels any pain.
Push against my hand. Does that hurt? Then it's not the peroneals. So let's now test for the CF.
To test the CF, or calcaneofibular ligament, you should choose the Towler tilt test. Make sure the foot is in the plantar flex position and hold the distal end of the ankle. Place your thumb on the CF and place force laterally towards the floor.
Do you feel any pain?
A little.
Maybe it's a fracture. Let's do the compression test.
And percussion.
And percussion test. Go.
For the compression test, make sure the knee is extended. Cup your hands behind the ankle, behind the side of pain, and compress the ankle while gradually adding more pressure.
First, let's do the compression test. Do you feel any pain? No.
If pain is felt, this could be a possible fracture site. With the percussion test, make sure the leg is off an edge and tap distally from at least a hand width away from pain and possible fracture spot, which would be above your hand.
Let's do a percussion test just to make sure. Any pain?
No.
Could it be?
Could it be a lateral ankle sprain? The ATF is the most commonly torn ligament in an ankle sprain.
Good suggestion, Allison. Let's do the drawer test just to see.
In a drawer test, make sure the knee is bent 90 degrees. Hold the heel from below with one hand while the other holds the lower leg. The hand that is placed on the heel should be on the anterior medial side and is used to push the calcaneus and talus into eversion, while the other hand grips the lower leg laterally and pushes medially.
Well, due to your torn ATF and damage to your CF, I'm going to say you have a grade 2 ankle sprain.
What should I do?
To treat a sprained ankle, follow the 4-step procedure called RICE. This is an acronym for rest, ice, compression, and elevation. For rest, stay off of your ankle using crutches when walking. Ice for at least the first 24 to 72 hours of the injury, or at least until the swelling goes down, for 20 minutes on and 20 minutes off. With compression, use an elastic such as an ACE bandage to reduce the swelling. This should be done for the first 24 to 36 hours. Elevation is the last step. Raise your ankle above your heart for 2 to 3 hours a day to reduce swelling and bruising.
Wow, thanks.
Just doing my job. It's MRSA! Does that hurt? Doesn't hurt. No!
Ow! Don't do that! You're hurting it! They need to keep telling me I'm doing it! You just gotta press a little bit.
Let's do the percussion test just to make sure.
Is it going?
A tongue twister. Let's do the percussion test just. Guys, like, what's my problem?